Finance Committee of the Oakland County Board of Commissioners to order at 3:55. 2:55, sorry. Would you please call the roll?
Commissioners Cavell?
Here.
Kowal? Here. McGillivray?
Here.
Howell? Charles?
Present.
Long?
Here.
She's
Long is
absent with
running
notice.
late.
Yeah.
Moss? Markham?
Here.
We have Terry O'Corn.
Thank you. With that, let's all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Next up, I need an approval of the agenda. I need a motion. Commissioner Moss, supported by Commissioner Cavell. All in favor of approving the agenda, say aye. Aye. Opposed, say nay. The agenda is approved. Next up is public comment. Is there anyone with us today from the public that would like to address the Finance Committee at this time? Seeing no one, I will close public comment. We have no communications, and we will move into our first regular agenda item, which is Facilities Management, Facilities Planning and Engineering, Sheriff's Office, Emergency Management, Feasibility Study for New Sheriff's Operation Center, Oakland County Emergency Operations Center, Sheriff's Office Training Center, and Strategic Storage Facility. I need a motion. Commissioner Moss, supported by Commissioner McGillivray. Good afternoon, gentlemen.
Good afternoon. So before you is a resolution that I'm guessing everyone is very familiar with at this point, considering that we discussed it for over 3 hours yesterday afternoon. And I know we've provided a pile of backup information regarding the project. But in short, it's a resolution for a feasibility study for a new EOC and 911 dispatch center, as well as a sheriff's office training center and a strategic storage facility. So I don't know if anyone would like any background on maybe the needs for the facility that the sheriff's office or emergency management could speak to, or if you're already familiar with what's been discussed and we want to lead right into questions.
Commissioner McGillivray?
I wasn't here for the other meeting, so I'd like to hear the need more than anything.
Okay.
Yep. Go ahead, gentlemen. Thank you.
Regarding the Sheriff's Office Training Center, sir, Sheriff's Office, right now, our training facilities are spread various locations all over the county, and they have been for quite some time. Pre-COVID, we were retrofitting our facilities that we had out of Brown Road, our old boot camp program, trustee camp building, Frank Brennan building, and using them for training for the department. As COVID came on board, we had to vacate that property because the county was going to take and house homeless people out there. They had some study come out, or some people come out and evaluate the buildings. There was black mold in the buildings, so they decided not to use those. We couldn't use them any longer either. So we were scrambling to trying to find somewhere to take and conduct our training. There was a school that was available, a developer owns privately in Brandon Township. He was going to develop it into a community center, but because when COVID took place, he couldn't develop the property. He leased it to us. We've been leasing that property for approximately a year and using it as a training facility. We're conducting several different types of training out there to keep our personnel trained up. We have also, at that location, we do classroom training. We have a ground fighting training, ground tactics training area there. We run a corrections academy out of that facility, which we're running one right now. It's a very well-used building that we're using, but it's only a temporary fix for us because once the lease is up, the property owner is going to take and develop it and turn it into a community center. We have our range facility was built with the jail in 1972. We have 5 lanes. It was designed to accommodate the department when we had 150 deputies. We have we have 900 deputies that have to qualify on a monthly basis. So we're extremely behind the curve with that. We have a simulator that we use for training purposes for de-escalation, officer tactics. It's a 3D visual system. It's located where the old health department is. So we have our range in the jail, simulator here, our training facility, temporary training facility in Brandon that we're utilizing. Right now we have to recertify our officers every 2 years with pursuit intervention training, emergency vehicle operations. Right now we're leasing or we're renting space at Schoolcraft College in order to conduct that training with vehicles because we don't have a facility to do that. We used to have access to the airport, but the FAA has shut down. They don't let us out there anymore. So we're very limited in what we can do. We have nowhere to go in the future once the contract runs out with the facility that we have.
Just add a couple of things. I know yesterday some of the things came up. It's not just the sheriff's office that uses this facility. Today we posted on thank you. Today we posted under Sheriff Mike McCabe. We posted on OAKTAC today on goes out to every department in Oakland County that's part of OAKTAC. 9 different training sessions for active shooter that all the departments now will sign up for and use, and that will be done at the temporary facility in Brandon Township. All the narcotics enforcement team members that are from our departments, everybody here has somebody that's represented that's on narcotics enforcement, goes through training there. So this first step, the feasibility study, will then determine, what's the cost, what's the design, what are all those things that was all discussed yesterday, which I won't go into. You're somewhat familiar with it, obviously. We did send you, I think you got about a 3.5-page document that Connie should have, or either Connie or Michael sent you that lays out all these different factors. But it's not just, we call it the Sheriff's Office Training Facility, but it's not just for the Sheriff's, it's for all 41 police agencies in Oakland County to be used by all 41 police agencies, in short.
And I'll speak to the Tom Hardesty, Director of Emergency Management, Homeland Security. The Emergency Management Operations Center and the Sheriff Dispatch Center, those buildings are from the combination 20s and 50s. Significant issues with room, particularly for dispatch to expand. They difficult to take on more contracts with space. Limited access for the electrical and some of those setup, as well as an example just a couple weeks ago, the tornado in White Lake. Those buildings are not designed. Our staff is coming into a building to tell people to take shelter, and dispatch and our staff can't take shelter because they're the ones that are expected to be working in the middle of that response, and they're not in a place that's secure and safe from a tornado that's hitting just a couple of miles down the road. So, and again, we've mentioned technology, the ability, electrical, maintenance issues, space issues, a lot of those things with that building. And then as far as the warehouse goes, that was a part I had asked to be included. While we're doing this evaluation, Central Services has 5,000 square feet of warehouse. It's not designed to be a warehouse. It's a place where items are dropped and then pushed out to departments. And, during this pandemic, we've certainly been in that position of trying to find places to store PPE. We're also now leasing a warehouse in Pontiac to temporarily store. So we thought while we're looking at these other buildings, it would be a good time to at least evaluate and get an idea of what would it cost for a warehouse.
And if I might add on the 911 EOC Center, as those of you who've been here a while know that, in fact, Chairman Woodward was very instrumental in consolidating PSAPs here in Oakland County, 911 centers. 20 years ago, we had 36 PSAPs, 36. Today, we're down to 19. So there has been consolidation, and many of them have come to the sheriff's office to contract. We have 11 police departments and 19 fire departments that we now dispatch for, in addition to those communities that we service. But, like Tom said, there's no room at the inn. So we've had inquiries from other departments that I won't name, but we told them, hey, I'm sorry, but we don't have room right now. So that's another factor to take into consideration.
Any idea on square footage that you want to build?
But yeah, it's all in that packet that Ed has, so I'll
Yeah,
let him answer.
just rough numbers, and of course, the feasibility study is going to help us, gather a better number, but the EOC 911 dispatch could be potentially around 75,000 square feet. Sheriff's Office Training Center, possibly around 80,000 square feet, and then close to 130,000 square feet for the storage facility, which Mr. Hardesty mentioned would house emergency management, PPE, those types of things, but also what is being housed over at another lease facility that we have, which was referred to as the Quality Pontiac Building over on Elizabeth Lake Road.
So there's 4 pieces of it. There's dispatch, there's storage, there's vehicle storage, which is the Quality Pontiac piece of it.
Well, it's
and-
equipment storage. There
Equipment.
are, yes, it's like, all the SWAT equipment, all the marine equipment, all the boats, all of that stuff.
Right. And then the 4th piece is the training center.
Right. And an EOC dispatch would be, they need to be co-located in the same building.
Right. Okay. Okay. So with that, I'll open it up for questions. Commissioner Cavell?
Undersheriff, you just said that EOC dispatch needs to be where the training center is?
No, they need to be in the same building. EOC and dispatch right now are co-located in the same building. They're across the hall from each other. There needs to
Not
be
the
that
training
coordination.
center.
I'm sorry.
Oh, okay.
Sorry.
Gotcha.
EOC and dispatch are currently in the same building, and they need to be co-located. They have been co-located since, well, in 1972, when the jail opened, they were co-located in the basement of the jail, outgrew their space needs, and went into this building where they are currently, the 2 buildings are currently in that are at least put together in the 1990s. And in the 1990s, we were told it was just a temporary setup.
Gotcha. And if I may?
You have the floor.
Oh, okay. This just dawned on me hearing it for a second time. Why is it that we're doing a feasibility study for all of these things together? Why not one at a time or a couple and not another 1 or 2?
From my understanding is that there is a need for all of these facilities, right? And they are operated by emergency management and the sheriff's office, and it would make sense to locate them in proximity to each other. So we're taking a holistic view and doing a feasibility study for all 4 functions that would be housed in 3 separate facilities.
Okay. So the training center, say for example, a sheriff's office training center would need to be near a strategic storage facility or EOC, emergency operations.
It would make life a lot easier for us and everybody else. Right now, the temporary training facilities at the Genesee County line, so it's
Yeah.
not real easy for Hazel Park, Ferndale, Royal Oak. They got a 40-minute drive to get up there and a 45-minute drive minimum, if that's, there's no traffic to get back. So right here is the center of the county. This is more centrally located.
Yeah. Okay.
Anybody else have questions? Commissioner McGilvery?
One more quick one.
Yeah, that's fine.
Location, is it on campus here?
Well, yeah, that was talked about yesterday, the feasibility study. Well, yeah, the good commissioner
I didn't mean to raise
here.
anything, I just,
Right now, we're looking at the 88 acres that we bought from the state of Michigan when Clinton Valley Center closed. That's a possible location. There are other locations potentially within the county complex that may or may not. I mean, it's pretty tight. I'll let the commissioner speak for herself on that.
It is.
I just wanted to let everybody else go the way they wanted first, but I will jump in on this. There is an amendment here that talks about implementing a study group for this. So this came to Economic Growth and Infrastructure yesterday, and for some of us, it was really the first time we had a chance to see some of this, and it was our understanding, and I believe the original resolution was written, that the Board of Commissioners would be part of this development of this RFP. And that did not happen, and so when it came before us yesterday, we had a lot of questions that were not part of the RFP. Let's talk about where's it going to be, right? On the whole subject of sustainability, the county right now has a study going, and correct me if I'm wrong, Mr. Dross, but the county has a study going looking at all of our buildings and our campus in terms of how we're using it, where are the people, what's our energy usage, where do we have obsolete buildings, and so on. So that's a piece of it. And then this proposal comes forward and says, oh, we want to take 88 acres of pristine land over here right at the beginning of the complex as you're coming in, and that's where we would put this. And so we raised our hand and said, you know, maybe that's the right place for it, but we'd really like to look more holistically, to use your word, at what the campus looks like and what might really make sense a couple, 3 years from now when this gets put in place. There are some other issues. I was most concerned about issues of sustainability, okay, in the meeting yesterday, but other commissioners brought up issues such as hiring practices, fair wage as we let this contract and so on. There are a whole bunch of things that we either can or can't be part of discussing, but we wanted to be part of the conversation. So what's before us is a proposal to move forward this I'm losing my mind, this MR, to do the feasibility study. But as part of that, this amendment says there will be a study group that works together for the next 6 weeks to make sure that our concerns are addressed in whatever proposal is going to come back to us from that. And I think everybody, the sheriffs, as well as the administration, agreed that that was a fair way to go about it. In the meantime, there's a bigger issue of how does the board get our input into these proposals at the right place? Because we don't want to slow things down necessarily, but we have concerns that in this case, nobody even thought of until one of us raised our hand and said, well, yeah, let's look at that too. So I've talked to administration and I've talked to Dave. I feel like we need a more defined process that says maybe the commissioners don't get to vote on who gets the bid, right? But we certainly want to be part of developing the bid before it goes out. On issues like this where we're talking 80, $90 million when this is all spent. We'd like to make sure it's the kind of thing we really want. So today we're voting on moving the feasibility study forward to really take a look at what this would really look like with the proviso there will be a study group over the next 6 weeks to make sure we flesh out what everybody's concerns. Okay? Does anybody have anything they want to add to that? Commissioner Cavell?
I'm a little confused now because I thought yesterday we amended the MR to make it, instead of $1.4 million, to make it $1.5 million, to then appropriate the funds, but then to do the enaction of the partners in architecture firm would be a separate thing we'll figure out later, if we like that. Is that incorrect?
We took those amendments out and are replacing it with this. So go ahead, Mr. Ward.
Thanks, Madam Chair. So, very good explanation, and appreciate that, and appreciate your consideration of this amendment. The $1.5 million is remaining in the resolution. There was just some refinement of the language to make it clear that the study committee will work with the administration and the bid evaluation committee, make sure those concerns and voices are heard that were missed in the RFP process. And then the board does have the ultimate authority for the release of the expenditure upon their review and decision on recommending a qualified bidder.
So if I understand right, step one, approve the MR as amended with this.
Yeah.
That then will make $1.5 million set aside for this feasibility study. Step two is this amendment then allows for the commissioners and executive to have critical review of the bid evaluation process. So once the bid is approved by that study committee or subgroup, then three, the Board of Commissioners comes back and says, we want to move the $1.5 million into a contract to help to pay for Partners in Architecture or wherever else we might find, or that Florida company, to then do it.
Just the slight,
Okay.
it's simply just to approve the recommendation of this study committee
Okay.
to, accept the recommendation of the bid evaluation committee. The language is written so that the input could be taken. If we have to reconvene the bid evaluation committee to, change this proposal somewhat, there's room within that language to allow that to happen. So
Okay.
you're appropriating, and then you're just sort of moving on to the very specific issue of the vendor,
Okay.
the service provider, the architect.
So we're setting aside money today, but in the future, we'll come back with a new MR to vote on of whether to enact the feasibility study or not.
Whether to select the vendor.
Gotcha.
Yeah.
Which will give them the money.
Yeah.
Okay, thank you.
Okay, anybody else have any other questions? So I need a motion on the amendment, is that correct? Commissioner Powell has a question.
No, I'll.
Oh, you're going to make the motion? Okay. And I need a second. Commissioner Charles? Commissioner Moss? I'm always bad with names. I really apologize. I'm glad we have nameplates.
Call you Charles too from now on.
Commissioner Moss, you had a question?
No, I was seconding.
Oh, you, okay.
You're looking for a second.
All right. I think we got Commissioner Charles second. Is there any other discussion on the amendment? If not, then please call the roll.
On the amendment, for one, Commissioner Cabell?
Yes.
Colwell? Yes. McGilvray?
Yes.
Howell?
Yes.
Charles? Yes. Long?
Yes.
Moss?
Yes.
Markle?
Yes.
Carried, 8 days, 0 nays.
Excellent. Okay, so now we're going to vote on the main motion as amended. Does anybody have any further discussion? Commissioner Powell? No. Commissioner McGilvray?
Do you need a motion or?
No, I think we have a motion on the, we have a motion, don't we?
Yes.
Yeah. Okay. Yes, Commissioner Charles?
Yeah, I just wanted to state, and I know this will come out probably in our, in the feasibility perhaps, but Under Sheriff McCabe yesterday mentioned somewhere around $200,000 that the Sheriff's Department expends on IT services. And after we settle all this, I'd still like to find out what that's about.
On IT services?
Yeah, you mentioned,
Maybe, I think it was over 200,000 in rent on just the one building alone.
okay.
I
I'll go
think
back and
that's
look
what I
at the
said.
YouTube.
Yeah.
Don't worry about it.
Okay, well, we can straighten it out. We're paying a lot of rent, and, I'll just leave it at that.
Okay, any other comments? One more, Mr.
Sorry,
Cabell.
just to make sure I understand, because we will vote on moving the money as a committee and then as a board in the future.
Right.
Again, okay, got it. Thanks.
Okay. All right, if there's no other comments or questions, please call the roll on the main motion as amended.
Commissioners Colwell? Yes. McGilvray?
Yes.
Howell?
Yes.
Charles?
Yes.
Long?
Yes.
Moss?
Yes.
Cabell?
Yes.
Markle?
Yes.
And carried at 8 days, 0 nays.
Great, thank you.
Thank you.
Thank you.
We'll look over 2 days to get that squared up. Not pretty. Yeah, the meeting started at 10 and we left at 1:30.
Oh, my gosh.
That was crazy. Good, thank you. Okay. So now we will move on to other business, which is, we're all really excited about the budget hearing. Of course. Yeah, these are fun. Central Services asked to be delayed to the 18th of the month. Mr. Vanderveen had a conflict and wanted to be here to be part of it, so we agreed to let it move. So first up then is Public Services. I see Mr.
Already
Gatt.
up there. Ready for the hot seat.
Yeah, let me find
I don't know if it's that hot. Oh, McCabe was sitting in it. It probably is a hot seat. Yeah. Where is he? He's gone already. I didn't even look yet. Yeah. Hot seat. Hot seat. Oh, it's on page
this thing.
248. We're doing public services in 76. Well, we're changing facilities management to health now. When is that true? Are we doing health instead of facilities management today? Or no? Health and Human Services says 4 o'clock on the agenda.
Yeah, I think it's health. I don't think it's, we did facilities last week.
Okay, so that was a mistake.
Didn't we do facilities last week?
Yeah, Aaron. Aaron.
Did we? Yeah,
Aaron.
because this is wrong, that, you know.
This says Public Services, IT, and Facilities, but I think it's really the Health Department. Am I correct?
Are you Aaron?
Yeah. Oh, you're Mike? Oh,
Mike.
I thought you were Aaron. I've been getting stuff from Aaron all this time, and I thought it was you.
I think we're doing it at 4, right? Just to make sure.
Of course, all the women are like, ooh, look at the shoes.
Like he's been working on it.
You know what? Also, he looks like an Aaron. There you go. More than a Mike. That's fair. We can do that. That's kind of like an Aaron.
It checks out.
All right, so we're doing health, I think.
It's too much for me. Right now, we're going to do
Public services. So they have page 248.
248. Okay. Good afternoon, everybody. Good afternoon. Again, welcome, Public Services. Go ahead and introduce yourself. I'll start by introducing my mayor, Bob Gatt, who actually runs animal control. But
Thank you, Commissioner Bob Gatt from the Animal Shelter. Correct.
where's the puppies?
Barb Hankey, Community Corrections.
I am Heather Calcaterra, the interim manager at Children's Village.
Great, excellent. All right, so, let's find you. So the way we've been doing this is, if you, as a department, want to tell us a little bit about your budget and what is changed, hit the highlights, what should we be aware of, and then we'll have the board ask you questions after that, if they do. So you want to go ahead and start, Mr. Gatt?
I will begin, and I will tell you that just prior to the budget being starting, we had an outside assessor come in as a request of the Board of Commissioners, and that assessor was in the middle of doing her work when we got a notice from our administration that all departments were mandated to cut their budget by 4% of their personnel costs. That threw animal control into a little tizzy because we really didn't have anything to cut. So, but complying with the order, we did come up with a solution that would have probably hurt the operations dramatically. However, administration agreed that they wouldn't do that. And in fact, at the end of the line, they did not require us to adhere to that 4% cut. What we did decide to do was to raise our revenue. And of course, the only way we can really raise revenue at the animal shelter is to raise the price of a dog license. Every year, well, during a normal year, it hasn't been normal the last year and a half, but during a normal year, we sell about 60,000 plus licenses, and we're going to raise the price about $5, which is going to bring in about $300,000 more in revenue. So in lieu of a cut to our budget, we're going to keep what we have. In fact, the finance department, Mr. Jen and company, agreed to even add one position to our role. We're going to get one full-time eligible veterinary technician, which will help us. The study, I'm sure you're all aware of it if you read it. The study was very complimentary. This is an independent assessor, had nothing to do with anybody in our building, anybody in the state for that matter. And she found us to be way above the national average when it comes to our live release rate, which was 90% last year. And in my world, that's no kill. We don't claim to be a no-kill facility because we're an open admissions building and we don't know what's going to come in. So we don't have the ability to turn people away. However, she also found that we're way above the national average in our return to owner rate. So she was extremely complimentary on everything that's going on at the shelter. I would hope that all the commissioners are very proud of the shelter. I know I am. Our staff is working very diligently, because she also found that our staffing level was below base level to accomplish our goals. But still, we're accomplishing our goals by doubling and tripling our work efforts. Somewhere in the study, she writes that the average county in the United States of America spends between $4 and $10 per capita on their animal shelter. Our budget is about $4.7 or $4.8 million. So Fulton County spends about $4.80 per person on their shelter. We're team players. We're gonna do the best job that we possibly can with what we have, and we appreciate everything that the county, the administration has given us. I talked to Mr. Jen even just before this meeting, and hopefully I can persuade my people to give us one or two more people at the front desk so we can stay open later, at least one night a week, to serve the public even better. But other than that, we're very pleased with the budget. We're very pleased with the operations, and I'll just shut up. But come on, see us at the shelter. We got a lot of kittens over there right now.
All right, well, let's take each of these departments independently and kind of crank through them, okay? So does anybody have any questions for Mr. Gatt? Commissioner Moss.
Thanks. We can't take any cats. My wife's allergic to them, so, but...
There's pills for
that. You tell her. All right, so I just want to be sure, because I was kind of paying attention to the shelter assessment people, and they had some great ideas. How's it going in implementing the recommendations?
Well, we've implemented or are implementing about 70% of them so far. Some of them, budget-wise, staff-wise, we just have at a dead end. We can't do some of the things that she wants us to do until and unless we can add staff numbers.
Have you got, because I was really quite excited on some of them, particularly the one that they're saying that some ungodly percentage, almost what was it, 85, 90% of people who surrender dogs don't really want to, and they wouldn't if they had some kind of help to keep their dogs, and to move the focus to helping people keep their pets. Then you don't have the pressure on the animal shelter to have to take them in. So is that one that you're working toward?
That's one that we're working on. That's going to be an ongoing. That will never end. That's staff communicating with people either in person or on the phone when they call to give up their animal, by offering solutions and is finding out what the reason is really. Are they allergic, and there really are pills for some things? Or is it they can't afford the food, and maybe we can help a little bit with some of the foods. We get a lot of donations that we can pass on to people. So we're working on that on an ongoing basis. That will never end.
Okay. The other one is the sort of the change of the philosophy from the feral cats to community cats. So they're not lost. They know where they are. They have a neighborhood. People take care of them, but they're just kind of wandering around because they're cats. What about any change toward that?
100%. We haven't euthanized a feral cat long before Dr. Pisano came in. We put a stop to that. Now we are full bore into our TNR program. But again, Commissioner, more work. More cats are coming in. That's more work at the front desk, more paperwork, more work in our vet area, and more work getting them back out if the people who brought them in can't take them.
Or catch, spay, and release.
It's trap, neuter, and return, actually, TNR.
I like
But we
better.
are full bore into doing that. yes.
Okay, thank you.
Thank you, Commissioner Moss. Commissioner Powell?
So we're still just in the animal shelter?
Yeah.
correct? Okay, question. In regards to this employee concerns or more employee staffing you need, do you know what those 2 or 3 or however many positions you need to fill? What is the amount that is you're requesting if we were to, fill those positions or you get those positions filled? And if you've called the question, what was said to you and why they said they couldn't fill the position?
Well, the front desk are called animal shelter attendants, and that's our lowest priced full-time employee in the
Pay
building.
is an issue.
Yes. So, well, no, we'll fill those easy if we were authorized to. They cost, we just had somebody from HR did this now a few months ago, so it may have gone up a little bit because I know the salaries have gone up. But it was about $50,000, including benefits and salary. So we would, if we had 2 extra, I believe we could open late one night a week to serve the public, one more night. But again, I know that that's not in the budget, and I'm not here to hold that over anybody's head. We're going to make do with what we have, but we just can't add to our task right now without more people. And Dr. Verzano, the assessor, was very clear on that.
Well, you're stressing an issue in your department. And if, I just wanted to call the question so us as commissioners understand and know what is going on in there so that we probably, maybe, well, for me, I'm still learning process, but at the end of the day, our department still needs to run self-sufficient. So if that's the issue, I think it's just something that we could call a question too, just to ask and see. Because it is a lot of departments, we got a lot of stuff moving, we got a lot of stuff being shipped. So I just wanted to get clarity so we know. So I'll call the question and ask myself for HR.
If you've read the study that the board commissioned, you'll see very plainly and clearly what the recommendations are.
Okay, thank you.
Anybody else? I know last year we talked about you needing another vet tech, and I'm really glad to hear that
So
you're
am I.
gonna
And we
add
were
that to
very
your staff, because that, when I toured the shelter, that was clearly, your poor vet and the vet techs are like for as many animals as you have coming in. So I was really happy to hear that.
Thank you, Commissioner. Dr. Pizzano suggested in her study that there be 2 vet techs for every surgery going on. Now, we don't have anywhere near that kind of capacity now, and even with the extra one, we won't. But it's going to help a lot.
Right.
We're happy.
I'm glad to hear that. Okay. If there's no other questions for animal control, let's move on to community corrections.
Yes, thank you. Good afternoon.
Hi.
Again, Barb Hankey. So our budget, we're very happy with it. We were able to meet the 4% budget task for this next fiscal year for this budget by eliminating 1 full-time position in our pretrial services unit. As many of you are aware, because of COVID-19, there was a significant drop in the number of arrests and custodial arrests in particular coming into custody. So that did allow us to let that position go and won't impact our service. I am hoping that we can possibly, through our state grant, pick that up at a later date if numbers return to pre-COVID.
Okay. Anybody have any questions on this one? Commissioner Cavell.
I was looking through this and I may have misread something, but I see here, if I understand your revenues, your charge for services fee income is supposed to double. Why? If I'm reading that right.
Our fee revenue, that you may be looking at the wrong one, that might be from the ME's office. Our fee revenue was pegged at 155,000.
Yeah.
Unfortunately, most of that revenue comes in from what we call our WAM program. It's our work crew program for misdemeanors. Unfortunately, that program has been suspended since COVID started because we can't put 14 people in a van together and meet the CDC guidelines. So our revenue has basically been stagnant. So we have no plans to double that. So I'm sorry, I don't see.
Okay.
Or were you talking about from what we actually took in from last
Yeah.
year? Oh, I'm sorry. I understand. I thought you meant we were doubling our revenue for next year. We do have some programs that still generate some revenue, and we're hoping that at some point, by around the first of the year, we might be able to reinstitute that program and still save some of that revenue. But it, how this COVID and Delta variant goes, that remains to be seen.
Yeah, okay. The second question is, I remember you coming before us back when we were still in line talking about the need for, if I'm remembering the terms right, people, you were covering the cost of drug tests and ankle tethers for people.
Correct.
Thanks to COVID or due to COVID, and you were worried that you were going to run out of money soon for that. I don't know where to find that number in here, but do you have that money? Is that part of your budget? Do you need more?
So under special revenue,
Yeah.
For a grant for going into FY22, I was able to secure $50,000. It hasn't been approved yet. That'll be coming before you when those contracts are awarded. And under the JAG Burn grant, I asked for another $24,000, which has been approved, and I think will be on a later agenda for you to approve as well.
Sorry.
So yes, I was able to cobble some money together that's not general fund money.
And is $74,000 what you need to do that in a fiscal year?
We'll see.
Okay. And also, this just kind of popped up, and this might be more of a Kyle and Glenn question, but there was a 4% cut across the board, and Animal Control was able to avoid that, even though it also, because in part it generates revenue, I imagine, but Community Corrections, which also generates revenue, still had to take the cut of 4%?
Well, we operate as, even though we're separate divisions, we operate as a department, and so public services is a departmental budget.
Okay.
So where maybe, I think, Kaz and I maybe could be a little bit over,
Okay.
that overage went towards, some of the other budgets. So we're a team, and over the next several years, we'll collectively get to that number.
Okay. Thanks, Barb.
Okay. Anybody else have any questions? Okay. Thank you. Let's move on.
Well, again, my name is Heather, and I'm the interim manager at Children's Village. In terms of the task that was set before us, the 4%, we met that standard by eliminating 5 full-time positions and 9 part-time positions. So we came in right around 2.64%. We came in a little under because right now it's a really interesting time in Michigan and many states in terms of child welfare and juvenile justice. Trends are changing. There are some new standards in terms of leadership in Michigan. The governor, for the first time ever, implemented a juvenile justice task force. There are changes in terms of the Children's Services Administration leadership that trickle down to us on the county level. So we really wanted to take a good look at our workforce to make sure that we can meet these changes moving forward. There are changes to licensing rules, required contract, established ratios, requirements to become more trauma-informed, hands-free, therapeutic environment. So that's why we came in a little under the 4%, but we're still very happy with our budget, and we're pretty confident with what we have presented.
Questions? Anybody? Commissioner Long?
So on the school meals, is that 100% refundable, that $300,000? Do we get refunded for all the meals?
Yes, I believe
Okay.
so, yes.
All right, thank you.
Excellent. Commissioner Cavell?
Yeah, hi.
Hi.
We've been on the internet, like on the Zoom.
Nice to meet you in person.
Oh, yeah, that was a little bit,
That's
no,
what
just
I meant to
kidding.
say. Right.
Better change that in a meeting.
Hot mics, right? Looking through this, I noticed that the Children's Village transferred into public services from
The health
Health and
department.
Safety.
Yep.
Yeah. Why?
That decision is above my pay grade. I don't have an answer for you. I apologize.
Okay.
I can certainly try to get that for you. I believe it was just part of a master restructuring plan. I think it made sense to put us with public services.
And juvenile and, adult
Oh,
community
okay.
corrections, juvenile, I think it seemed to.
It seems like a good fit.
Yeah.
Okay. If you guys like it, great.
We're a great team.
Anything else?
It's working out pretty well. so
Commissioner
far.
Cavell, anything else?
No, thank you, Chair.
Any other commissioners have questions? Okay, and you're last, I guess.
Kaz Myarka with the Medical Examiner's Office. So prior to even this budget, we had already started doing some restructuring in the office and eliminated some positions that were no longer needed. And in this budget, we were able to, a supervisor took the early buyout, the VSEP, so we did not replace that position. It was not needed, we restructured. We did ask for an increase in our cremation permit fees. We went from $40 to $55, which still puts us one of the lowest in the state. Genesee County is just a little bit lower. Everyone else is charging $75 to $85. We're still staying at $55. But that's for us to keep up with the demands of the cremation permits and what it really takes to approve those at that point. And the other fee increase that we asked to go from was our private autopsies. We were charging $2,000. We are going to go up to $3,000. The last time we've had an increase in those was since 2004. So it was time, when we did a study and broke down everything, we were losing when we were doing private autopsies. So outside of that, our budget, we're well within what we're able to do, so that's why you're probably seeing the increase, Commissioner, in some of the fees for us. But that was long overdue. The last time the cremation permit fees were raised was 2014.
Okay, thank you. Commissioner Powell.
Is someone here from Veterans today or no?
Veterans is no longer under public services. They were moved
Oh,
into,
yeah.
into the health division, I believe, so they're probably up next.
I saw it.
Yeah, I think it's just
No, it's
because,
fine. It said it clear as day. I just didn't pay attention.
Oh, no, it isn't.
Sorry.
It's under Health and Human, yeah.
It's right there. It say reorganized. Right in my face.
okay. Anybody else have any questions for the medical examiner? I just have a couple. Did your workload increase dramatically because of COVID? Or, what was the effect?
So COVID-19 is it's a natural disease process, so those cases wouldn't come to our office anyway. The
Okay.
workload, the only workload that really increased, we received a few more calls, but we didn't bring in any extra cases because of COVID. We did have cases that came into the office that were COVID positive, so we test every case that comes in. But no, it did not increase that part of the workload, increase in calls that they call in reporting the death, but that's a natural disease process, so it's not required for us to.
We're not going to see it at the medical examiner. Okay. And you talked about private autopsies and going from $2,000 to $3,000. How do we compare to, Washtenaw, Genesee, Wayne County?
So there's not many places that actually do a private autopsy.
Okay.
But the ones that we did the study on, Sparrow Hospital charges $5,000, Western Michigan charges $5,000, Michigan Institute of Forensic Science in Saginaw charges $3,500, and Dr. Spitz from Macomb charges $3,500. So we're still well below what a lot of people are charging. We try to keep our costs just at what we are needed to cover what we actually do into our, and that's a lot of it is a lab cost for us and the cost for the doctor.
Seems pretty thin. I mean, I'm glad you're raising the price if it costs us that much to do it. Yeah, okay. Commissioner McGilvery.
Just a quick question. That's only for a family that would request an examination?
That's correct. We are required by law to do certain autopsies, suspicious deaths, unexpected deaths, homicides, suicides, drug-related deaths. So these are cases where a family just wants to know why their loved one died. So they'll make a phone call to us, and really the doctor reviews the case and determines whether they would take the case on or not. Sometimes it's for a civil matter. They want some more information. Most of these cases are natural deaths that would not come to our office. So this is just a request by the family. It's not something that is required by us, so that's why we're in charge of that.
Okay.
Thank you. Anybody else? All right. I think that's all for this department. Thanks for coming in and giving us your review. It's always good to hear what the different departments are doing, and I'm very proud of this county and how much we do. And
Pretty good.
yeah, right.
Gwen?
Yes.
One,
Commissioner Powell.
the mayor.
Mr. Gatt.
Mr. Gatt.
Commissioner Powell has one more question.
Would you say the increase, okay, for you to now need a staff person, was it like that before COVID as well? Or was it, or you needed it pre-COVID? Oh, okay, all right. Thank you. Thank you.
Thanks, everybody. Okay, where's my agenda? I don't know about you guys, but my mind turns to mush about after a day like today. Okay, so next up we have information technology, and Mr. Tim contacted me this morning and said he has the sniffles of some sort, and we certainly don't want him in here with us.
Absolutely not. Absolutely not.
So he asked if he could please make his presentation virtually, and I
Thank
said
you,
sure.
Chair Markle. Thank you very much.
I appreciate the welcome, Commissioner. Thank you.
I know, right?
All right, and we're pretty much back on track for time, so that's good. All right, go ahead, Mr. Tim. Tell us a little bit about your budget and what its highlights are for this year.
All right, thank you. If I could also go ahead and, I do have the IT leadership team. You guys can all do your cameras. Jeanette McKenna is the manager of our internal services team. Tammy Shepard, the manager of our application services team. Jeff Neesmith, the manager of our Clemis team. E.J. Wyden is our chief technology officer. And TJ Fields is our Chief Information Security Officer. So just by way of a brief introduction, when we're talking about IT, we're actually talking about 5 separate funds. There is, of course, the IT fund, which is the largest, but there's also the telephone fund, the Clemis fund, fire records management, and the radio fund. And these are, as Pam had brought up on the screen earlier, as we get into them, they are all proprietary funds, which means they're basically fed by revenue that comes either from the general fund departments or it comes from outside. So they're not directly funded by the general fund in most cases. So we have to relieve our cost through billing for the services we provide. So, and that's primarily what we do, is provide services to other county departments. Although there's obviously some exceptions around web pages, web support, and obviously some of the Clemis support and services. Some of our GIS support and services are provided directly to citizens. Access Oakland would be another example where we provide directly to residents or citizens or other government entities. But one of the key parts, since most of our budget is actually providing services to county departments, we execute our projects, we execute our budget management, we execute our ongoing support and maintenance through what we call the IT master plan. And that is a 2-year planning horizon that we work on every 2 years to work with the departments and prioritize activities around their strategic initiatives, their business objectives to support residents as well as the services that they provide. So that IT master plan is a public document. You can see it, everyone can see it at oakgov.com/IT/PMO for Project Management Office. And one of the key aspects of that is it gives us an opportunity to work with the departments directly on a quarterly basis as we review the status, but in that planning process to help prioritize IT projects and activities based on the needs of those departments.
Can you give us that website one more time, Mr. Tim?
Yes, it's oakgov.com. So it's the main OakGov website /IT/PMO.
Okay, thanks.
And not only is the 2-year plan published out there, but we also, every quarter, we publish a status report that we have reviewed with the departments to show the progress of basically how we spent IT resources, particularly people in most cases, to execute those projects. So I do want to just briefly mention, we did achieve, we are planning to achieve the 4% budget reduction that was asked of us for this year and the 7% for the following 3 years. We have done that primarily through some staff reductions, and that is reflected in the budget. What you may have a question about is it actually looks like some of our budget numbers are going up, and some of that is actually a function of one of the changes in the fund balance policy that Kyle Jen reviewed with you in the original budget presentation, and how we allocate assigned fund balance. In IT's case, for some of the IT projects, we had fund balance already designated for some of our projects. And as part of the new fund balance policy and as part of the budget recommendation, we've actually moved some of that previously assigned fund balance is now directly into the IT budget. So we did achieve our cost reduction targets, but then on the flip side with the fund balance policy change, some of those numbers increased so that those project dollars would be directly in our budget already. So I just want to briefly talk a little bit about some of the accomplishments and work that this budget funded over the last year. Obviously, a big part was remote work and the ongoing support of over 4,000 workstations for county employees. GIS, Geographic Information Systems, and dashboards in many different arenas, but most particularly to help the health department and communication, not only of COVID statistics, but another area that GIS and dashboards were used was actually in some of the reporting that we did with the use of the CARES funds dollars. Dozens and dozens, hundreds probably, website updates that were executed over the past year, again, primarily to help communicate statuses for the departments as well as out to the residents and folks that use services from the county. One of the areas that, I think is kind of behind the scenes, but was very, very important, several years ago, the board approved authorization for a document management system. And we actually used that system to help us process tens of millions of dollars in grants of the CARES funding that went to CVTs, small businesses, to charitable organizations, et cetera. That document management system was instrumental in helping us speed up the process of getting that money to the people that needed it. We've also been working on and implemented projects ongoing in our core network infrastructure, including improved access to the internet, public safety reliability improvements, and of course the radio replacement project. There's also ongoing improvements in our security profile, including single sign-on is being implemented across multiple applications, and everyone's favorite training buddy, Blake. And I know most of you know who Blake is because we have been watching, and the Board of Commissioners in particular is doing very well in their security training. So I want to thank you for your support of that as well.
Yeah, and we all hate it.
So these are some of the more visible projects, but I also want to make sure I mention there's so much that goes on behind the scenes in our operations, our support teams, our application teams, our project management teams, our help desk, so many groups that quite often are not customer facing, but they're really the folks that keep us running behind the scenes. And I just wanted to make sure that I acknowledge them as well. They're obviously a significant part of our budget also. So at this point, I'd be open to take any questions you have on any of the 5 funds or other questions about IT.
Okay, I'll open it up to the commissioners. Commissioner McGilvery.
Couple of questions, Mr. Kim. First of all, how many current positions do you have vacant in IT?
I believe that is 18. Let me double check. We have, we're authorized at about 170 full-time. We also vary between 50 to 60 contract labor positions. And yes, at the moment we have 18 vacant.
Okay. And it's your hope to fill those 18 positions?
Absolutely. So many of them are, they're being actively recruited, as we speak. We have several recs that are open, and some of it is just a matter of timing based on project needs, but also the timing and our ability to, bring the people in, to do the recruiting, to onboard them, et cetera.
Okay. My next question is, how safe is our security system and what needs to improve to make it better?
I can't answer that in a public forum, and I'm kind of kidding, but there is always more to do. The bad guys are always looking at new ways to attack, and we have to continue to be super vigilant. Not only on the technology side, but there's been a significant increase, a significant focus on things like email and different ways that threats come into our systems, and most experts will tell you that the biggest liability we have is our people. It's the people that use our systems. So training is one of the best strategies, and that's why we continue to push that, and we will continue to try to make it as effective and likable, usable as possible, knowing that it's not something that everybody likes to do, right? But that's definitely one of the areas that we have to continue to focus on. But we also have multiple projects, like the single sign-on, is a state-of-the-art project, a state-of-the-art product to help us improve, our access systems, our ability to monitor who has access to our systems, implementing multi-factor authentication, so that you get a text coming back to your phone and says, "Did you just try to log in?" Those kinds of things are all strategies that we are continuing to implement. And there's several things that are behind the scenes and kind of under the covers as well, to help protect us. But the job of that part of the technical infrastructure is probably one of the most complex. I kind of liken IT in that regard to a castle, and every time we give access to a person to access data, we're kind of punching a hole in the wall of the castle, and we have to do that, right? I mean, that's how people do their jobs. But every time we punch a hole in that wall, it requires a lot of engineering to make sure we stay safe. So it is something that we are constantly keeping our guard up on.
Okay, thank you.
Thank you. Anybody else? Commissioner Moss.
Hello. Hey.
Hello, Commissioner.
Hey. So I remember, they used to say that the I in IT stood for Imperial. It was sort of all the rest of the departments got to give tribute to IT. And believe me, they complained about it. But if the aim was to, during a revolutionary period of technology, keep Oakland County ahead of the game, it's worked. So, but now I just want to know is, how are the charges that you levy interdepartmentally? Is a mouthful. How are they determined?
So we work with the fiscal services team, and over the last several years, those charges, they have been based on a rate study that was completed several years ago. And essentially, in the last few years, we've basically just, kind of agreed to apply an inflation rate to that base rate study that was done. And that determines, the charges for man time, the charges for network infrastructure, print services, etc. Now, that being said, for example, we are implementing a new phone system, and because the telephone system and the telephone fund is a separate fund, we have the ability to identify, specific dollars that are allocated towards the telephone, and it's easier for us to identify, this is what a telephone is going to cost, and the use of that phone and voicemail, etc. So those charges are a little bit maybe easier or distinct because that system is just recently being replaced. But it is an area that, as we worked with Kyle, Jen, and the management and budget team, fiscal services team here over the past year, and part of, again, that fund balance policy change for some of our IT projects, the next step for us to implement beyond the IT project funding is now also to make sure that the rates really reflect the services that we provide.
I'm not going to be a broken record on my opinion on the fund balance policy. It's been passed and is going to go on. But now that you're converting fund balance to current account, that's what it sounds like, will that have any effect on what you're charging, your single source customers?
Well, yeah, charging is it's a little bit of a misnomer in that. Yes, we do. Really, what we're doing is allocating costs, right? The general fund funds the IT portion of their budgets, right? So as we identify that they're going to use so many workstations, and we have a charge rate to cover our infrastructure costs that's based on the number of workstations that a department uses. Those dollars are put into the department's budget. So it's that department, in essence, is getting free money, if you will, from the general fund to cover their IT expenses. So charging is again, it's a little bit of a misnomer. It's really more an allocation of costs.
Well, yeah, say we allocate, let's pick a number, $1 million to the animal shelter, and the animal shelter is going to give $50,000 of it to IT. And IT figures out what charges it is, and it goes in, and you guys figure out what you need to keep it rolling. I'm just, just want to be sure what the charge. Oh, what's the rate for inflation that you're using right now?
Jeanette, do you happen to? I mean, it's been a couple %, right?
Yeah, so it's and it's not actually we don't have a set rate. It's based on an analysis that the fiscal services staff does based on the actual expenses of that prior year. So they capture everything and then determine to make that whole. So yes, it could vary anywhere from 2% to on the operations hardware side. A couple of years ago, it was a little higher than that, more like a 4 or 5%, I think, increase.
You're not using CPI?
No.
I don't blame you. I wouldn't either. All right. Thank you.
Thank you.
Anybody else have a question for IT? Commissioner Powell.
It wasn't necessary for IT, but I just wanted to put it on the commissioner's radar that when we met with HR, I had requested that we get a list of reclassifications, all of that information of the set questions that we have, be sent to us, like kind of like a total package, just to give us an update as to how many reclassifications and all that stuff took place after the comp study. So I just wanted to put it on your radar. We have not received it yet. I did share an email just a few minutes ago with the chair and our staff just to see and follow up on that information for us. Because when we were asking those departments, they really didn't know, and she said that she could pull that report for us. So I just wanted to put it on your radar so we can kind of limit those questions because we're getting a report from her. So I just wanted to share that with my colleagues.
They did say they have it.
Yeah. So I just sent her a text, an email, so that Gwen can follow up with HR for us.
Okay.
Just to kind of expedite the
All right. Anybody else? IT? Commissioner Cabell.
Thank you, Chair.
You kind of alluded to this earlier with Commissioner McGillivrary's question, Mr. Tim, but about cybersecurity, and I guess, yeah, I know so little about this, and you're not at liberty to discuss it all publicly, I suppose, but you mentioned training, single sign-on, multi-factor identification, and that the weakest link for cybersecurity is the people that work for OakGov. The county executive's budget message talked about JBS meets and the Colonial Pipeline and all that. Is that because JBS meets people had a password of like 123 ABC, or is there something more complex there that you're also addressing? And is that also part of why your budget is going up?
So most of the really big breaches that get a lot of public attention in the last few years have come through an email and a malware, or they were practices where the IT team maybe didn't get all of the patching done on some of their infrastructure. And everybody hates patching. People don't really like to patch because it requires testing. It often breaks things. We have to, reverse. We have to redo, and nobody likes to do that. And patching for a user is essentially like taking your car in to get an oil change once a week or once every 2 weeks. But it takes a whole day to get the oil change done. I mean, it's a pain. It is not convenient, and your system is out of service and potentially breaks after the oil change. So patching is a very difficult thing to do, and it's very complex. And that has been one of the major reasons that some of those breaches occurred, was that there were security vulnerabilities that weren't patched. So I am proud to say that we do an excellent job of patching. We pass the audits that are done on us frequently, whether that's from the state of Michigan for CGIS or other bodies. We pass those audits with flying colors, and one of the reasons is patching. But these other dimensions that I talked about are all things that we are trying to help our users be a little more sophisticated, whether that's through training or access into the systems be a little more sophisticated, like through multi-factor authentication as an example. So it's a multifaceted problem, and there are so many, what in security they call threat vectors, that we are monitoring both automatically as well as manually, and areas that we're trying to contain and areas that we're trying to monitor. So it's a multifaceted program.
Okay, thank you for that. You mentioned the account fund balance policy change showing that your budget is going up. Can you explain a little bit how much that's making your budget go up? Because over the next couple of years, looks like, if I'm doing my math right, your budget's going to go up by $11 million.
Well, so there's a couple things that are affecting what look like budget increases. One is we have some major projects that are adding infrastructure. So essentially, we have assets being added into the IT fund, and those are through the UCC program, which is over a $10 million project. The radio project affecting the radio fund. That's a $60 million project, of which probably $50 million of it is capital. So those capital items all go into the balance sheet. They become assets, and then they affect the depreciation stream on our income statement. So as those changes occur, as those big projects come in, they look like big swings in some of our expense side of our budget. And they are big swings, so that's what those projects do. We have projects related to core infrastructure, our servers and storage and our firewalls. Those projects are part of the assigned fund balance, and that assigned fund balance is going to be added to an IT technology fund where we will draw that money for those projects now into IT as we execute those projects. Same thing, we have to replace our printers throughout the county, and that's $1 million+ worth of printer acquisition. So those projects, look like they're adding funds to our budget. So those are examples of that.
So, and I stepped out for a minute when you first started talking. Did you have to do your 4% department cut?
Yeah, yes,
Okay.
we did, and we achieved that. We did eliminate some positions. So we did have some reductions in staff through the voluntary employee separation program.
Okay. But no one had to be laid off. People just took the VESIT.
Correct.
Okay. Thanks.
Okay, anybody else have anything for IT? Commissioner Moss.
Yeah, I got a couple questions, and unfortunately, they're not related to each other. First of all, with the COVID and working from home and are you seeing a change in the needs and the demand for IT services as more and more people want to work from home, or the office use and office footprints change? Are you seeing a change that you guys are having to respond to?
So, yeah, the short answer is yes. The longer answer is we actually have some flexible infrastructure. We have some tools in place. We were able to, allow people to work remotely on almost no notice, right? People were able to work from home almost immediately when that order was given. And that's partly because of some of the flexibility we have in our infrastructure. We've continued to improve it. We are flexing from, a model where people use multiple PCs to using a single PC and access into our networks. One of the other things that we have done strategically is we've moved some of our services out to the cloud. Services that we support, but then also services, a key example would be Workday. Workday is a project that's being implemented right now, but the HR module was implemented over a year ago, and every county employee, every retiree can access their Workday account remotely because it's in the cloud. So our email is the same way. It's out in the cloud, and that was long before COVID. So, again, I think some of it is, technology provided some of that framework and ability. But yes, we have also been adapting our capital plan over the last few years. We had actually forecast that more and more people would use laptops instead of desktops. We had built a program, and we're implementing now to improve Wi-Fi in the county campus. And, people have asked, why don't we have better Wi-Fi? And part of my response has been, well, we don't have anybody that's really using a mobile type of workstation. But as that changes, as people move from desktops to laptops and they are more mobile in their work, Wi-Fi makes a whole lot more sense, in terms of connectivity to the network. So that Wi-Fi project is underway and is already complete in several buildings. So those are examples of things that were already underway before COVID. Another one is voice over IP. Voice over IP gives us, significant amount of flexibility outside of our current office space from a telecommunications and just collaboration perspective. This tool that we're using for this meeting, GoToMeeting, we have at the county just implemented Microsoft Teams, which provides, some of this similar meeting kind of functionality, but it's also integrated with our email. It's integrated with our county chat function, integrated with our document sharing system. So those are other examples. Again, those projects were already ongoing before COVID. And these technologies, as they have been implemented, have really just helped provide that support.
So you're not basically planning any radical changes to deal with what might be a radical change in the way that people work or, do business.
I think the area that we still can provide some additional flexibility, and I think we all can learn is, we have worked with FMNO, with Ed Joss and his team, and they have been working with HR, so it's kind of a collaborative effort around, what does the new office space look like, right? So certainly these tools that we have in place are going to help facilitate that. But I think we will all come up with new and better ways to use the telephone system, for example, to use collaboration tools. And, I think it is going to be a new day, a new challenge for the county workforce to continue to learn and grow and know how to use these tools to be more productive regardless of your location. So, yeah, I think there's still ongoing work in that, and we still have ongoing projects in that regard.
Yeah, thanks, because, you've got a plan from a year and a half ago. You don't want to be all ready for yesterday's future, Okay, all right, and I'm looking at the department revenues. Looks like it jumped right up in fiscal year 2019. Is that any Hello? They cut me off?
Yeah, I'm still here. I hear some background noise.
Committee room A, we hear you all. We in committee room A.
Was it something?
Who else talking? Is they in the other room?
Yeah, listen to something else here. Can you hear me?
Yeah, it's like a presentation.
It's okay.
Oh.
It's not. There's a budget presentation this time for the tech malfunction with the IT people. So you give us more money for more go-to meeting stuff.
So the biggest
is we use Teams.
Yeah.
Okay.
It sounds like the mics are picking something up from outside the room.
Okay.
Yeah, it do sound like they're from outside the room.
Oh, so we have a little, yeah. Sounds to me like they're talking in Romanian here. Okay, are we back?
Good.
I was hearing people talking in Romanian.
Oh, yes, it is. Getting off the rails.
Yeah, we are, aren't we? That's what happens when. I think we just got hacked by the Romanians. All right, fantastic. Last question. Departmental revenue seemed to have taken a jump in 2019. Any reason why?
So we're just the IT.
Total revenues actual, yeah.
Mid 19 to 20.
2020 would have additional transfers in for COVID-related work.
Yeah, so in the IT fund, is that the fund that you were referring to?
Yeah. If you need to get back to me, no worries.
Well, do you understand what Ms. Zonka said?
A big part of that, as I mentioned, was it looks like a jump in revenue, and it's really from assets that have been added to our balance sheet and the impact that they have on the income statement from some of these big projects that we've been doing. So it looks like an addition in revenue, but it's really not.
Bookkeeping.
IT accounting has always.
Yes, in 2019, we started working on the Workday project as well as several other projects that were driving money as reimbursement for those expenses into the fund. So that is basically covering those expenses too.
Okay. All right.
It's all in relationship to what we work on. The money comes in based on the work we do.
That is
And
it.
that was a major jump in expenses.
Muted.
We started performing the work for, say, the Workday function, that project.
Okay, thank you.
Does that help?
Sort of, yeah. I'm sure thank you.
Okay, Commissioner
Can you
Moss.
hear me?
Yeah, and again, Commissioner, if you were looking, and that happened for sure in the radio fund as well, as that project got kicked off. But the IT fund, I think,
Unmuted.
page 591.
Oh, somebody moving fast. And you can hear us still? Can you still hear us now, Mike? Okay.
Yes, I can.
Yeah, we
Yep.
were talking and we weren't getting no response from you all.
Okay.
Right, and it happened during the IT.
So, Commissioner Moss, are you finished?
Yes, thank you.
Okay. Commissioner Kowal.
Everybody's getting a little slap happy and it's still early, so. Anyway, yeah, I just wanted to comment on what a great job you all did, and I'm sure the health department had to do with it, as well as standing up that savior spot for the vaccines. I think that really made a lot of big difference, and I mean, we were all getting all kinds of emails about getting vaccines, and anytime you made an announcement that you had them, people would go stampeding to try to get them. But the fact that you were able to stand that up like overnight, and it just made the process a whole lot better. So I just wanted to comment on that and just say it was a job well done.
Thank you very much, Commissioner. It was definitely a team effort on, both the website side as well as one of the technologies that we were especially fortunate to be able to implement there was a call center that, to your point, we were able to stand up in just a couple days. And it was able to field all of those calls coming in from folks that wanted to get scheduled, and gave us the ability to, make phone calls back to them, to get in touch with them, to add additional operators and distribute some of that workload. And it is something that, we're continuing to spread that technology through the other departments that have call center capability as well. But thank you for your comment.
All right. Anybody else have any questions or comments for IT? Well, thank you. Don't see any. So thank you for coming today. Thank you for sharing your department with us. And we look forward to working with you in the future.
Likewise, thank you for having us.
Hope you feel better.
Yeah.
Thank you. Have a great day.
All right. Next up, we have Health and Human Services. And they are one of our departments that has gotten a lot of visibility this year.
Most popular department around.
So welcome.
Thank you. Can you hear me okay? I usually
Yes.
have a loud voice, so I don't need a microphone. Thank you for having us this afternoon. Leanne Stafford, Director of Health and Human Services, with me. I also have our MSU Extension group, so Sheila Letty and Edward Scott. And also on the phone, hopefully they're there, Stacy Smith is our Administrator of Fiscal Services in the Health Division. And most of you know Shane Bass. He's definitely been here, our manager neighborhood. And so I just wanted to give a little summary about the department and then open it up for questions. And we'll all be answering questions. As a new director, I'm still learning about all of these divisions myself. So as you probably remember, just a little bit over a year ago, Health and Human Services was reorganized into 3 divisions, and that's the Health Division, MSU Extension, Neighborhood Housing and Development. And this reorganization really aligned our programs and comprehensively addressed social determinants of health, and that was across all of our divisions. And so it was a great alignment between the 3 of them. And so a little bit about our workforce, because I think that's a really important piece to bring to here. We have all these amazing services, but it's our employees behind it that really, engages and brings the life to these programs. So in Health and Human Services, we have 351 employees. 295 of those are full-time and 56 are part-time. It's important, and we continue to promote and hire a diverse workforce. Currently, the department has 43 vacant positions. 15 of those were vacated with the VSIP program. We have filled 9 of those. We're currently trying to fill 5, and we actually eliminated 1 of those once that person vacated that position. As part of the upcoming budget, we actually deleted 14 positions, the majority of those being part-time. And then we did request 1 new classification. So a little bit about the budget. Our operating budget is just over $45 million. We have a revenue budget of just over $11 million, which includes charges for services and state and federal grants. And as part of our 4% cut, we did reduce our budget by just over $743,000, but a little under the 4% request. We have professional services contracted that are budgeted for our fiscal year 22, and that is included our MSU Extension Program, Health and Human Services, and the Health Division. And lastly, I just wanted to give some numbers, really looking at what we've done over the last year in all of these divisions. So Mr. Tim talked about that amazing Nurse on Call, Amazon Connect services. Since October of 2020, Nurse on Call has fielded just over 173,000 calls. I mean, that is huge. I mean, that's a fraction of what we normally do. For vaccines, we have given 172,000 doses of vaccines at 1,509 events since December of 2020. So in addition to all the services that we've provided, we've also put a lot of work in there. MSU Extension has just under 80,000 virtual interactions with Oakland County residents. Again, been very busy. And Neighborhood and Housing and Development completed just over 3,000 referrals, provided information and services. And Oakland 360, which, is our new initiative, no wrong door for healthcare services, actually saw 1,290 clients in our offices. And that's when we were significantly reduced in services, and it's actually been a very, very a great success. And so I just kind of wanted to give a little bit of overview of that and then ask if you all have any questions for us regarding budgets.
Okay, I'll open it to the commissioners. Commissioner Powell.
It's not a direct question. I just wanted to see with the new variant coming out, have we seen significance here in Oakland County with how that is turning out?
Yeah. So
it was a short.
So yes, obviously the Delta variant is what we're seeing about 90% of the cases here in Oakland County. Our cases have jumped from being 10 to we're at close to 100 and a 7-day average cases per day. So a significant jump in about 3 weeks. We're still just at 4% positivity rate, but when you look at the new CDC chart, that puts us in substantial transmission in the community. So, what we are seeing is increase in hospitalizations, and the majority of those hospitalizations are in unvaccinated residents. We are seeing that breakthrough cases, right? A very small amount of breakthrough cases, and what that means is somebody's fully vaccinated, but they still get the virus. But it's very mild, right? But they can transmit it to someone that's unvaccinated. So that continues to be our push. Watching, really encouraging mask wearing, both vaccinated and unvaccinated when you're in large groups or indoor areas where you just can't maintain 6-foot social distancing.
Go ahead. One more question. 6 feet away from I forgot it'll come. I'm sorry, I forgot.
I'll add one more thing to that, though. We schools are going to open very soon, and so I just want you to know we are really pushing a big back-to-school campaign. Anyone 12 and over can be vaccinated, and so we didn't stop just because we got to 70%, right? We're going to continue. We have hundreds of events that will be available for people to get vaccinated at. We're working with schools, health centers. We're going to be at events. We're every day at North and South Office. You do not have to make an appointment. You can walk in. But what I do ask is, I hope this group and others, commissioners can continue to promote vaccinations. That's how we get past this, is to continue to vaccinate. And if you have an agency or a group that reaches out to you and is very interested in a vaccination clinic, please let me know. Our staff are ready to jump in and give vaccinations wherever we can. So.
I know another question.
Yes, Commissioner
If
Powell.
someone received a shot and then, I guess, months later has some type of reaction or something like that, what is first line of action they need to take, and who should they contact if somehow they think there may be a possibility from the vaccination?
Their best bet is to talk to their healthcare provider. So whoever their provider is, have that question. You can always reach out to Nurse on Call, right? It's hard for them to try to diagnose, right? They're nurses, they're not doctors, and so usually a provider will have a good understanding of a health history and to know, is it something else? If it is a reaction to the vaccine, there are steps you can take to report that to CDC, because they do track those. And so, but the best place is their primary care.
Yeah, I just got a couple of calls from people, so I just want to I want to be able to tell them the steps of what to go through.
And most providers know how to report that. It's called VAERS. It's a CDC system.
Do you know if we've heard of any where people have lost their hearing after?
We have heard,
yeah. Hearing, and now they're no hearing.
We have heard of instances where people were reporting after having COVID. I haven't heard any about the vaccine, but again, I don't hear all the vaccine reactions, but it could be, we have heard, trouble hearing after having COVID.
Got it, okay. Thank you.
You're welcome.
Commissioner Long.
And I wish, thank you, that was a great presentation because you gave a lot of numbers of staff and stuff, so I appreciate that. I just have one comment. When I went into the health department, whoever was answering the phone, and I wish I would have got her name because I wanted to call you for vaccination appointments, was the most patient person I ever. No, she was so patient. She didn't know who I was or anything, but I was sitting there waiting, and she was so patient. She would listen to every symptom, everything about their husbands, everything. I'm like, holy moly, if I had your patience when she hung up the phone. I mean, she just was she did not cut them short. She was so nice. I mean, I should have got her name because she deserved an award for that, because she was on that phone just listening, because people were all concerned, but then they start talking about their personal life, and she was so professional. I would have been like, oh gosh, my baby's crying, or something, I gotta go, or something. But she was just wonderful. I got very, very professional and went well beyond her Call of Duty answering that phone.
I appreciate that feedback.
Yes.
We, during the pandemic, we have, accepted help from everywhere, right? So we had Children's Village staff, as they reduced their capacity. They came over and joined our team, WRC, MSU Extension. And so we had people that had never really taken calls like that, but, joined our Nurse on Call group. And it's just an amazing asset to see how we all kind of bound together, and it just was an amazing response to everything.
She was excellent.
So,
She had, I don't know what department she was from, or there was a regular position, but she was just so good. I was very proud of her. So.
Thank you.
Yeah.
Anybody else have any? Commissioner Cavell.
Thank you, Chair Julian. You kind of touched on it about schools. I've been hearing from some of our constituents about who's in charge, really. Is it the state? Is it the county? Should the school district do something? What would you say?
Okay, so, last year there were a lot of mandates that came down from the state level. And so, you can look at things two ways, right? So the health officer has the statutory right to create orders and mandates, right, that they can push down to the public health safety, right? That same state health officer has those same rights, so where you see MDHHS. And so those, orders or emergency orders they may put in place is what defines who is responsible. So if the state puts something, obviously that locals will either, recommend the same, or we may be a little more stringent, right? We can't be less stringent than what the state may order us. Instead, we may be more stringent. And so that's where sometimes you would see, we had a mask mandate last year. What didn't last very long, but what happened was the states relapsed their mask mandate, and we felt very strongly, especially at that time, that Oakland County residents needed to continue to wear the mask because we know, I'm just going to throw this in here, masks do help, right? We know they help when someone is sick to, keep that transmit from happening. So, schools have their own, they can, if it's a mandate, right, the schools should be operating under that mandate. If it's a recommendation by the health division, the schools could determine if they wanted to create their own recommendations.
Okay.
So
you could make a mandate.
We could mandate, correct, or we could make recommendations.
So do you want to do that?
We are working on school guidance right now. It has not been released yet. It hasn't been finalized. And so what we're hoping to do is provide that to the superintendents first and allow them, I'm not saying I won't share it with you, we'll share it with you all as well, but share it with the superintendents so that they can see what our recommendations are and be able to think through it and how they're going to pass it down through their school districts for the year.
When do you think that'll be ready?
At the latest next week. Because we know school's starting. CDC just came down with theirs. The MDHHS just came down with theirs. So we just want to make sure we're in alignment with what everyone is requiring. And things are changing very fast. That's, in 3 weeks, we went from, thinking school year was going to look maybe a little bit different to, maybe the changes just because of the increase in the Delta variant.
Yeah. Okay. Thank you. And your three more quick questions. You had this 14 staff cut, $743,000 budget cut.
Most
of that money came from staff, right?
It was part-time positions, yes.
Okay.
We had some contractual services that we cut, software support. So we had 2 applications that were helping us with the ECHO project. And so we wanted to combine those into one. So this fiscal year we'll be, combining those into one as we move forward with ECHO.
Okay. And then when I was looking through the budget, I saw a couple of lines, and forgive me if this is just going to be too in the weeds, so we can.
That's okay.
Later.
Like I said, we're all here to. This is where this group is going to help us around here. So.
Okay. If I understand it right, there's all these private institutions for foster care, private institutions, residential, private institutions. What are those?
So those are probably contracted services. Let me get to. I'm sorry?
Yeah, contracted services, 231. Yeah.
No, maybe to our line item, that there's those little numbers.
So we contract with Care House. We contract with AAA 1B. We contract with, oh my gosh, what's the other one? I just lost it. OLSA. And so some of those could be from Children's Village that should be transferred out of our budget as well. So, so 231. I think some of those. Stacy, can you help? Is Stacy on there?
Yeah, my computer shut down, so I'm on the phone.
Okay.
Yeah, those are all from Children's Village. Those were actually transferred out. So if you scroll over to where it says fiscal year 2022, those should all be zeros where they were transferred out.
No, it is in our book. It's on this one.
Okay.
I don't know about that one, but it's on this one.
Okay.
Oh, cool. There you go. You're back.
Okay. Fair enough. Thanks. And maybe because we were just talking about the Delta variant, this isn't a good question, but thinking about what happens to your team and your budget as we, come through COVID or something, what feels like what's going to happen? What do you think?
You mean coming back into regular services?
Yeah.
What
should change in your budget?
I don't think anything will change other than, we're going to have to continue now, right, with our mandated programs, right? So the state relaxed some of those requirements over the last year to say, I'm using Hearing and Vision, for instance, right? Hearing and Vision, they maybe schools, they weren't in schools, so they were allowed to use and come and help us with the COVID response. And so, we're getting back to what is normal, but we're also going to have to maintain vaccinations, right? Case investigation, or contact tracing. And so we're really looking to use some contracted services that we've used. So there's an agency called Intech that has really assisted us throughout the year, throughout this COVID. They're nurses, they're medical professionals, so we can bring them in and help supplement so our staff can kind of get back to the normal programming and then still work as needed with, like I said, contact tracing and case investigation as needed.
Okay, and then just one last question and one comment. Last question is, in the ARP or ARPA guidelines from the Treasury Department, out of the 151-page document, the first 90 of them are all about social determinants of health. And you started your whole pitch for the budget talking about social determinants of health. So is there anything we need to take notes on or something? Or
no, I mean, we kind of talked about it when we brought, but it's been a while. So, really that social determinants of health is really just those conditions in which you live and, work and grow and play in. And so we see that as an important factor in the health division. We've talked about this, it's kind of become a new buzzword, right, a little bit over the last 5 years, but feel like this is very important in all the programs that we provide. And I know, Shane's area does, and, I know MSUE tries to do that. And so I just think, again, those words, it's something we've always talked about. Now they've just kind of grouped it into one area that we kind of call it the social determinants of health. So we're always going to continue to look at how our programs can advance in those areas, and also how we, kind of can work as a department and make sure all of those needs are met for our constituents and our citizens.
Thanks. And my comment is back to the Delta variant. So you said something that sparked my mind. You said the contact tracing. I got a call from Jamie at the Public Health Department, who was super communicative, super helpful when I got the Delta variant, even though I've been vaccinated like a month ago. So that was great, and it was just, I was really proud to be like an Oakland County person with a badge, with a...
You have the Delta variant.
I had it like July 4th or 6th. Yeah, that's why I zoomed into that meeting like 3 weeks ago. Yeah.
Yeah. Okay.
So it's real.
Yeah. I mean, how sick did you get? Just at home, or?
Well, I got sick, so that's the point, right?
Yeah. No hospital.
But saying it was great. Jamie was awesome.
Thank you.
And she texted, and she even when she she did everything really well. Where she went, where did you go before you knew you had symptoms, and when you thought you had a sinus infection, what did you touch? And she helped. She texted and called my sister-in-law who has kids, and it was great. She walked them through everything for an hour. Jamie was great.
Good. Thank you.
I know you knew that, but yep.
Anybody else have questions? I just have two questions. One is, so a lot of what you do is with grants. You get lots of grants. Who writes them for you? Who on your staff sits down and writes grants?
And so our health educators are, we just finished up one that we just submitted. Stacy can smile about that. But we have a team of health educators that, depending on their expertise, they'll try to write it. But what they do is there's a number of them, right? So somebody might be very good with budgets and try to put the budget numbers together. Someone might go out and be very good with data and go look for those data points. And then someone might be really good at writing. And so they all come together, and there was about 5 of them that just worked on this grant that they were trying to get for substance abuse. And so it's a team approach. It really is. And they've been doing this for a while. There are courses you can take on how to write grants. And so it's just, I think over time they work that into their everyday job, because it's a very important part to bring, money in for those services if we can. So.
Okay, and I don't have another question. I just have a comment. I have been so impressed by how you handled everything with COVID, from the get-go, from the jump. Anytime I get a constituent question, you have answers. It's just been, it's been really, really good, and it's another reason I'm very proud to be part of Oakland County, because we hit that 70%. And I really attribute that to the health department and everybody who's been doing the communicating and all of that. So, yeah, we're lucky to have you.
Thank you. You know what, I take that for our team, because it really was a team approach, so I appreciate that, because it's nice for them to hear that, too. Thank you.
Commissioner McGilvery.
Yeah, you not only did a fantastic job during the pandemic, but you always did it with a smile on your face.
Yes, didn't she?
Every time you turn around.
Man, you're forgetting the most important, that wonderful accent. You're forgetting the most important thing. A smile and a good accent.
Thank you. Thank you, everyone.
Everybody.
Yeah.
Well, if we don't have any other questions or comments for the Health Division, that concludes our budget hearings for today. If we don't have any other business to come before the board, I will, do we want to talk about, okay.
Oh, he's going over a 700-page review.
There you go.
We're going to say no to you. Kyle, we're saying no to you.
I apologize.
Oh, no, it's not 700 pages.
They have been sitting here all afternoon, waiting to speak, and I just blew right past them. Thank you.
Okay, now we have a 700-page review. We're not done.
Oh, right.
It's not 700, Kyle.
Okay.
Oh, we thought it was this will be quick.
Thank you.
Thank you.
Bye, thank you.
Yep.
So how sick were you? Like a flu?
Yeah, I had a fever for 2 mornings and like sinusy stuff and runny nose,
So did they test you just for that variant when you did the test, or
They
what did they
tested
do?
me for this. I went to the urgent care when I woke up with a fever.
Okay.
And then the urgent care said sinus infection, but we'll do a COVID test. The COVID test, they did the PCR one, so it took like a day.
Yeah.
And so then they said, hey, you got COVID. And I found out actually because Beaumont, doesn't email you, or it went in my spam. So I found out because Jamie from the health department was like,
she called.
hey, so you got COVID. Let's talk about it. And I was like, what?
If you have COVID-19, so where would you report?
If I had what?
If you were well sensitized to the issue of COVID,
Yeah.
what you had and symptoms, would you have called, or would you just let me report?
No, because he went in because he
No,
felt
I went
bad
in
because he had a
because
temperature.
the first sign of signs or whatever, I thought it was a sinus thing, and the doctor said it was a sinus thing and gave me a prescription Flonase.
That's what they're doing. That's what the doctors are doing.
101.
They're
It was a slight fever,
sinus.
but it wasn't a.
And then they have COVID. 2 of my friends, they sinus for 2.5 weeks. So they had COVID. So they went
that's
all
what-
around town
Yep.
Wow.
with the
And this
sinus
is-
infection. 2 people. And I'm like,
Yeah.
I'm glad I haven't seen you. She goes, does your son want to come over? I said, are you nuts?
Not until
Come swimming. I said, you don't need to go swimming. I'm not getting in. I'm like,
Yeah.
she's like full. So she has to have people over. So I'm saying
Yeah.
it's an issue.
So much chlorine.
All right,
I know, but I'm
let's let Lynn and Kyle do their thing.
Yeah.
So this will
Bring
be
it
quick,
to
I
me.
promise. So at the last,
Yeah. Oh, sorry.
at the,
You can have this one. I'll get
there
another
should
one.
be 4 on this side of the table as well.
Yeah, Chuck has extra.
Go ahead.
I think.
Chuck has
Yeah.
them all.
Yeah, you got to pass.
Oh, pass them down, Chuck.
You need one for
Eileen
yourself,
needs one.
Chuck.
I've got one for myself.
Eileen needs one.
Eileen
and then
needs one.
And then Charles need hers.
Charles needs one. There you go.
Okay, there we go.
So this is just an item to give you a status report on, since the county executive has released the recommendation for the budget. Obviously, the process continues. There are resolutions that are still enacted and adopted by the Board of Commissioners. So that we produce this amendment list. We'll give you a status of any changes that take place during the budget hearing process. So there is a summary and then supporting documentation for each one of the amendments. So you will see Section A are all resolutions that have been adopted by the Board of Commissioners since the recommendation was submitted to the board. So you will see it will reference the resolution number, the time in which it was adopted by the board, and you will see what is the total impact to the total budget and the plan use, the impact on the plan use of fund balance. You're going to see a lot of zeros here because in the detail, you're going to see the amendments happening between different line items. It might be a net neutral impact by an increase in certain line items on the expenditure side and a reduction to the other.
So for example, if you see beginning on the first page, A1 is referencing a resolution that was the fiscal service or management and budget second quarter forecast report that had some budget amendments. If you flip to page 5 of the document, you will see off in the right-hand corner, it'll say the reference A1. So that is the detail that was impacting. You'll see there's actual amounts there, but it doesn't have any impact to the bottom line. So Section A is all resolutions that were adopted by the board.
Okay.
Section B, if you flip to the next page, second page, those would be any any actions requested by the LAGO committee for personnel-related matters. There's not been anything that's come before that hasn't been taken up in a resolution, nothing outside of the resolution process. So Section C is what tends to be the new items for either corrections to items that were submitted with the budget, through the budget process, or adjustments that were made just before the recommendation was finalized. So you will see, for example, Section C, 1, 2, and 3, you'll see references where it'll say refer to reference A1. It's to correct something that was happening with the board during the process. We hadn't finalized the recommendation at that point. We need to make an amendment where we did some wage reopeners. At that time, we weren't sure if we were going to have planned use of fund balance or not, and subsequently, for the out years, we did have it for 2022. For 2023 and 24, there was no planned use of fund balance. But at that time, we did not know that. So you'll see on, if you flip back to page 1, you'll see like A2 said, we're going to use planned use of fund balance of $95,000 a year. When we did the recommendation and came through all that, we said, no, that we're not going to need to use that. We can actually reduce our budget equity adjustment or our contingency line item. So most of Section C is to true things up. No real change to the bottom line.
Okay.
The only one that we did have an impact, and again, it didn't change the bottom line in total, was Section C3, and that reflects an amount of $225,000. For some of you who have been here for a while, you know that we adjust the election supplies in even years because of the election needs for additional ballots, etc. So when we added the additional year of 2024, it inadvertently did not get added the $225,000. So we adjusted, we increased the election supplies, reduced the budgeted equity adjustments. Again, it's a net neutral change to the overall budget. So with this, you'll get an update for additional resolutions that come through that we'll add to Section A, anything additional that we find with corrections that may need to be made. Hopefully, I think we've covered most all of those now. And then you do not need to take action except to receive and file at this time, and you would approve or vote on the amendment list during the budget wrap-up session.
Okay.
Madam Chair, I would make a motion to receive and file.
Okay. Commissioner McGilvery, supported by Commissioner Kowal. We need a roll call or all in favor? A voice vote. All in favor of receiving and filing this amendment report, say aye. Aye. Opposed, say nay. Okay. Thank you.
This is bad.
I have a question.
All right, yes. With that, if there's no other business to come before the board, going once, going twice, the Finance Committee is adjourned.
I know. I know.